So a great way to begin a low back massage is just with a gentle stretch. Just tilt this pelvis in a way that opens up the low back a little more. And you do have to be firm in how you press to really open up that low back, but you don't want to press into bony structures in a way that's going to feel bad. I like to hold for at least 20 seconds. Another nice way to stretch out the back is to hold on to the ankle and do it that way, but I'm not going to do that today. So landing on this glute medius and just doing some compressive work in here, not going too deep. A lot of the time, the pain that people feel in the low back is referral pain. It can be from tightness in the hips, the glutes, sometimes even the upper back. So whenever anyone mentions low back pain to me, I think of how I can really help and treat it as referral pain first. I'm going to go ahead and just feel around this iliac crest, just feeling for any bony structures and seeing how much space I have in this low back to really work. And I'm also feeling for how sticky that connective tissue feels around the hip. And you don't necessarily have to feel around, but it can really help if you're working on a smaller framed person. So feeling for that last floating rib. So I have about that much space to work on. I do like to go back and forth between that glute medius and just warming up the area around the hips. I usually kind of flow in between different areas more if I'm working on someone that doesn't like deep tissue. Yet I'm working on areas that you do have to, offer some pressure to really mobilize the tissue more. And just working on this connective tissue around the hip bone. It can be a nice angle to work from if you step to the front of the table and you have a nice broad surface area to work with a soft fist. I like to just wrap all the way around that iliac crest. There can be some really good trigger points in here, but you don't have to worry about anything feeling too uncomfortable with this nice broad surface area we're working with. And I'm going to just land on this glute medius one last time. This is where I would start working with my elbow if somebody wanted deeper work. This area. Just going to continue with this soft fist. I'm going to grab my oil. Actually, before I do that, I'm just going to work on this sacrum a little bit. There's some really important nerve endings in here that can really affect the low back if they're tangled, congested. And just walking my thumbs down all the way towards the end of that tailbone. This is something that you want to make sure your client's comfortable with. This can be helpful for people that have sciatic pain as well, in combination with work on the piriformis. And just one last stretch before I grab my oil. I do like to work on these erector spinae a little bit because they can kind of take over when the low back is hurting. My main focus today is on that QL muscle, the quadratus lumborum, and it's okay if you need to move the arm if you feel like you don't have enough room. It's really good to just begin with your palm because there's so much sensitivity in there. You can be really clear about how much space you have to work with and if there's any swelling in here. And the beauty about the soft fist as well is you can really soften or harden your fist as much as you need to. Anytime that the fingers are relaxed and not tucked in, your fist is going to be a lot softer. So right now I'm just right now I'm just working on this thicker connective tissue around the hips, and I'm also working more superficially on that QL muscle as well. Anytime that you are working in towards the spine, you're just naturally offering deeper pressure. So I might not even work in that direction for someone that doesn't really want deeper work. And I like to just slow it way down. I would say low back is like on a smaller framed person is one of the more challenging things that you can do of we do as massage therapists. And I'm just tracing that last floating rib, being careful not to press too hard. If you feel like you're not having a lot of success, you can always just do flat palm and just wrap the outside of your hand around that iliac crest. You can get into that connective tissue in a really nice way, as well as working the soft tissue of the QL. And I'm just going to open up these erector spinae away from the spine and just creating space in between each one. And just keep in mind, because you use the forearm or the elbow, it doesn't really mean that you're doing deep tissue. I'm going to go ahead and transition into some forearm work. Usually when I change, from working with my hands to my forearm, I'll just check my stance and my own body, kind of check in, make sure I'm feeling good. And it's really good if you can work that tissue of the QL from a different angle. And I like to pass over the iliac crest, just stretching out that connective tissue. This is a pretty gentle way to work on the erector spinae as well. If you feel like the low back is just in this habit of being really congested and it needs more space, you can really open this up with this technique. This area up. I like to use my opposite forearm to just create even more space. You can wrap your forearm around the hip, just stretching that connective tissue a little bit more from a different angle, but be a little bit careful that you don't offer more than your client really wants with this technique. So I am in the perfect position. If somebody did want deep tissue, you can just start working in towards the spine, but I'm not going to do that today. Save it for another day. And I'm going to just travel up into the mid-back, opening up these erector spinae a little more. And this is a really nice technique to end on. Just gonna walk out my hands. That is all for today.